Hi and welcome back. In today's video, I am really excited to introduce you to Dr. Ania Weismann, an aesthetic radiologist with a practice in Placentia, California. Dr. Ania also has a channel here on YouTube, and I have been binge watching her videos. She has an incredible knowledge, not just of aesthetic medicine, but of anything skincare related. So in today's video, which I'm hoping will be one of many with Dr. Ania, we will be talking about skincare. Which ingredients to look for and why? Are growth factors worth it? What about retinoic acid? Is it really all it's cracked up to be? And then some. So without further ado, let's talk to Dr. Ania. Thank you so much for being with us, Dr. Ania.
Thank you for having me.
It's a pleasure to have you. I said in my intro that I have been binge watching your videos, and that is true. I watch at least 2 videos of yours a day because you have such incredible knowledge of skincare and you share it so freely, which I really appreciate. But before we dive in, tell us just a little bit about you. What is your background? What makes you happy with your job? Tell us a little bit about you.
That could be a whole video of its own. I originally trained in radiology, and I did my fellowship in women's imaging. And I worked in that for years and eventually ended up working in emergency radiology. And during COVID, I would say there was so much COVID, so much tragedy in the ER of all sorts, cancer, suicides. And it really drained me. And I ended up working from home at that time. So I needed something to bring me joy. And during that time, the world's best were all going stir crazy and giving free education online. So I was listening to Matthew Avram. He's a Harvard dermatologist. I was listening to anyone that I could. I got so fascinated. And I'd also actually opened up a laser center. That's an aside, but in 2009 with a friend of mine, because I discovered a laser that was painless for hair removal. And if you look around, nearly all laser hair removal services are very painful. And I could not understand why this wasn't available. And so I did some research, and there was no such laser in our city. And so we started providing comfortable laser hair removal. And that was my introduction. And with my background in radiation physics and X-rays, magnetic resonance, all of those things, lasers just kind of fit into that. And then I think my childhood love of beauty sort of started to blossom during COVID. And I just fell in love with it and just basically started learning online as much as I could. And then when the world opened up, I started taking as many courses as I could. And here I am today.
And now you practice aesthetic medicine, right?
I practice aesthetic medicine. I'm an aesthetic radiologist, so I'm very popular for my ultrasound abilities. I use ultrasound for high-risk injections to make them safer so I can see the vessels. And people also come to me specifically for ultrasound when they have filler that they don't like or they think has migrated. And rather than going for blind injection of Hylenex to dissolve that filler, I can actually see where it is and I can target it and dissolve right where I can see it. So that's been my niche.
Do you use that imaging also to inject or just to dissolve filler?
Sometimes. Usually what I will do, depending on the area, I will map so I know where the vessels are. And let's say I'm clear, I know that there are no vessels on bone and I know I'll be injecting on bone. Then I'll map it and then I'll put the laser away and then I'll just go in. Other times I may use direct guidance. I'm very familiar with that because when I did breast radiology, that's all we did. We did ultrasound biopsies. So you're always ambidextrous using both hands. So it's the same idea, except it's the face. And I'll watch the needle go in precisely where I want it. I'll do that, for instance, sometimes if I'm doing Sculptra and the parotid gland is right here, you want to miss the parotid gland. You want to make sure you're right underneath the skin so you can check with the ultrasound. But I don't like to do most of my injection under ultrasound because I find you want the patient sitting upright. You don't want them lying down. You want to see the effect you're creating. So I think you get a better result when you're actually looking at how the patient is, what the filler is doing, than having them lie down and then they sit up and things could be off. So
that's fascinating. That's a whole nother video. I definitely want to talk to you about that. But in today's video, we decided to talk about skincare.
Yes.
So your knowledge of skincare is just incredible. Tell us, in your opinion, what are the most important skincare ingredient one can use to reverse aging, prevent aging for healthy skin?
I would say there are two. It's sort of an ingredient product combination. The number one ingredient, without a doubt in my mind, is vitamin A derivatives. So retinol, retinoic acid. And the reason for that is that's an ingredient that's been studied for decades, and it's been shown to do so many wonderful things for the skin. It speeds up our skin cell turnover. It increases the production of healthy cells. So it actually helps reduce those precancerous cells. It controls oil. So it helps with pores. It helps with clogging of pores. It gives us, actually, there's a lot of controversy. People say it thins the epidermis, which isn't true. It thickens the dermis and it thickens the epidermis, but it does thin the stratum corneum, which is that dead skin cell layer right on top of our skin that's ready to slough off. Yes, because the turnover is so much faster, that very thin layer, that outermost layer ready to slough off, is thinner. But the epidermis consists of much more than just the stratum corneum. And when you look under histology slides, the epidermis itself is actually thicker and healthier and much more organized looking, and the dermis is richer in collagen. So it not only helps stimulate collagen production, but it also inhibits enzymes like matrix metalloproteinases that work to break down collagen. So it stops the breakdown, it increases the synthesis, it controls oil. It also helps reduce pigmentation by balancing the pigment producing cells. So it's almost like a jack of all trades and a master of all, which is exceptional for anti-aging. And the other ingredient I would say, which is more of a product, is sunscreen. If you just did those two things and nothing else, you would have very significant anti-aging benefits.
I agree with you. And Retin-A is definitely that's definitely Retin-A and sunscreen on my desert island products.
Those two, yeah. And with Retin-A, you really need the sunscreen too. So those two in conjunction.
Now, I'm glad you brought up that there is some misinformation around retinoic acid. Lately, there is some misinformation going around that retinoic acid causes fat loss. Have you heard this? And what do you think about that?
I'll back up in terms of maybe some confusion, because it does inhibit sebocytes. Sebocytes produce oil. So that's one of the mechanisms that it helps treat acne. It helps clean out the pores. It helps keep the pores open, and it reduces oil production. So part of it, I'm not sure if people confuse, or they just misconstrue that, well, it reduces oil, so it'll reduce fat. But in terms of, I've heard anecdotally patients say that they've lost buccal fat, for example. They've lost facial fat from retinoic acid. And there's no published data to support that. But there is data on mice that shows that retinoic acid can reduce fat. And so from the best of my knowledge is, it's so infrequent that it's not been documented and it's not been published. But I believe that if some individuals, and it would be an exceptionally small percentage of individuals, may have a Retin-A or retinoic acid sensitivity, they're hypersensitive to it, and perhaps it can affect them in that way. In my experience, I treat the skin with a restoration protocol that I follow Dr. Zaino Baji, who's a pioneer and a legend in his own way. And he's really the creator of the skin restoration protocols. And those protocols use a very high dose retinoic acid. People have to apply up to 1 gram. Not everyone. Don't try this at home. It really needs to be supervised, but it's up to 1 gram of retinoic acid every night. So the skin goes through a huge shock, and the benefits are incredible. And I think those people would probably, if you're going to see fat loss, you'd see it in that population because the dose is so high. And I have never heard of it personally. I've never seen it, and he's never mentioned it. So while I think it may exist, it's exceptionally rare.
Don't you think also when we hear of those things, it's something we use over years, and over the years we tend to lose some fat in our face. So
sometimes we have weight loss. That's part of it too. Buccal fat is also one of those places where we really lose it with age. So you're right. If someone starts retinoic acid maybe as a teenager for acne, and then they stay on it for anti-aging, and then they see fat loss, it could very well be just aging, weight change, things like that. That's why I think it's not been documented in the literature. If at all, it's exceptionally rare.
Good. I'm glad to hear that.
So, me too.
So as far as sunscreen, and I want to talk about some other ingredients as well, but as far as sunscreen, there are 2 camps of sunscreen, right? Well, 3 camps at this point. Some people say sunscreen is completely toxic and they're not going to use it. And then there's the camp only mineral sunscreen because we don't want any absorbed, though nanoparticles can also be absorbed. And then there's the camp that I have sort of gotten into, where as long as it's something I'm willing to wear, the risk of it being something dangerous or toxic is probably less than me getting skin cancer or sun damage. So where are you on that?
I agree with you. I'm in camp physical sunscreen personally, but I'll explain why. So I do agree. If you find a sunscreen that you're willing to wear, that's better than no sunscreen at all. So whatever that sunscreen is, by all means, I agree with you. The benefits outweigh the risks. In terms of it causing cancer, I think that may stem from the chemical sunscreens. It's my own philosophy, because it's been shown, studies have shown that chemical sunscreen not only absorbs into your skin, it can be actually found in your bloodstream a week after you've stopped using the product. So it lingers. It lingers in the body. Now, there's no study to show that it causes any harm. So that's why proponents of chemical sunscreen still push it. My view is there are so many things that take time to be discovered, even though they're already there. So I don't want to risk it. I don't need anything to absorb into my bloodstream. It might as well sit on my skin. And the other reason is that these days, physical sunscreen formulations have become so sophisticated and so elegant that now they match that elegance of the chemical sunscreen. So for me personally, the need for chemical has fallen away, just because you no longer need to have a white cast. You don't need to be sticky or greasy. The old ones, you had a white cast. They were very oily, very greasy. Now they're oil-free. They're excellent. But you mentioned nano, and I think that's really, really important, because whether it's a physical sunscreen or a chemical sunscreen, if they grind it down to such a tiny size as a nanoparticle, that's absorbing through your skin, even if it's a physical sunscreen, because it's just so small. And those are the sunscreens that are also toxic to the reefs and the ecology of the oceans. So that's one of the things I look for. I look for UVB protection, which is the standard that everybody talks about and knows about. It's the number that's on the product, but not so many people talk about UVA. And a lot of companies get away with saying broad spectrum protection, meaning it has UVA and UVB, but they don't disclose how good that UVA is. So when I shop for sunscreen, I look, is it nano? And oftentimes you need to dig to find out, because it's not on the bottle. And what is the UVA protection? And some companies disclose that. It's a scale of 1 to 4 pluses. It's the Japanese scoring scale. And the reason why it's so important is the UVA rays are the ones that go through glass, they go through clouds, and they're the ones that cause aging. They break down our skin. They're not the ones that give the burn and the tan. They're the ones that cause the aging. So it's really important. And so I try to get sunscreens that are at least 3 pluses or 4 pluses.
So retinoic acid or a form of vitamin A. Actually, let's talk about that really fast. So you said retinoic acid, but if somebody cannot handle retinoic acid, do you think the derivatives such as retinol or retinol are just as good? Are they just as effective?
Yeah, I use the term retinoic acid. I'll just explain why. Because once it's in the skin and it's doing the things we want, it is retinoic acid. So that's, I just did that for simplicity's sake, but absolutely, yes. A lot of people cannot tolerate tretinoin or retinoic acids, and so they could use retinols or retinaldehydes. And I think that that is a great option because ultimately a retinol is not a non-irritating product. In fact, in our body, when we eat products that have vitamin A, and our body transports that vitamin A to our bones, our skin, our tissues, our eyes, it transports it in the form of retinol. So retinol is a very inert, benign molecule. It doesn't cause harm. So when you apply that to the skin, it won't be as irritating as if you applied retinoic acid. And once it's in the cell, it does take 2 conversions, but it converts to retinoic acid. So for those who can handle it, I think it's a great option. The only thing to keep in mind is that retinol as a cosmeceutical is a very unstable molecule. So it really matters that you get a brand that makes a stable, good retinol. And unfortunately, I think sometimes it can happen where an individual can purchase a retinol and feel that they have no irritation, so they're happy with that, but then they don't see many results either, and they're basically just buying an ineffective product. So that's the only thing to watch out for when shopping. I look for retinols that are highly effective and that have been developed in a way to reach the deeper part of the skin. So not necessarily, usually retinoic acid will penetrate, or retinol will penetrate as deep as the basement membrane. So where all the epidermal cells are being generated and then pushed up through the layers until they slough off, and where the melanocytes are, the skin producing cells. If you take a higher concentration, or if you apply more of it, some of it will go to the dermis, and it can even go to the subcutaneous fat, which is maybe where the stories of the fat loss come in. And so as long as you get into those layers and you convert, whether it's retinol or retinaldehyde into retinoic acid, and you see the benefits, it's a good product.
Okay, that's good to know. Now, let's talk about some other ingredients. How do you feel about alpha hydroxy acids, glycolic acid, lactic acid, those sort of things? Do you find them beneficial?
I love them all. I love them all. I think that when we look at children's skin, they turn over their skin cells. In other words, from the moment that skin cell is created in the basement layer to the time it goes up to the surface and sloughs off, in children, it's about 4 weeks. In older people, it can be up to 8 weeks. So one of the goals in anti-aging is to speed up that cycle to help the skin mimic what it used to do when it was younger. And the alpha hydroxy acids are excellent in helping exfoliate that outer surface. And for people who don't like a physical exfoliation, it's even better. And for people who use conventional moisturizers, so conventional moisturizers really, they help everything stick on and not slough off. So if you use one of those, then the alpha hydroxy acids are extremely beneficial because they still keep the skin moving. They still keep things shedding. And we want that. Lactic acid has other benefits because it helps reduce pigmentation, and it's also hydrating. So that's a great one. And I think you choose your acid based on your sensitivity. Glycolic is the smallest, penetrates the deepest, and can be the most irritating. So everyone has to find the acid that is best for them, but I'm a huge fan, definitely. Acids are simple. They're simple ingredients and they're simple molecules. So I would say that's one product where you don't necessarily need to overspend to get a good product.
Now, do you think just like with retinoic acid, with continued use, you can get, let's say somebody is sensitive to glycolic acid, with continued use, they can get less sensitive and are able to use it more often, or?
I don't think I would even try. I think I would just stick to mandelic acid, which is quite gentle, or lactic. And I would say also, if someone is sensitive, what I do in my practice is I usually will try to actually treat the sensitivity, because the sensitivity is a sign that something's out of balance with the skin. So I don't take it as, oh, you're sensitive and we have to plan your future treatments based on the fact that you're sensitive. I approach it as, you're sensitive, so let's treat that first. Let's get you normalized, and then we can go from there. So if someone is sensitive, but they acclimate to a good dose of retinol, their sensitivity should go away, and then they should be able to use glycolic acid. So, but of course that takes time, months and months and months to see those changes in the skin.
Now, I have heard some dermatologists say the more acids, the better. And then some people say twice a week is really all you want to do. How do you feel about that? Depending on your skin, or?
Depending on your skin. I personally exfoliate both physically and mechanically every single day, and I have no irritation. But my skin is retinized, and I think that's a huge factor. Once your skin is adapted to a good amount of retinoic acid, so basically what you've done through that is you've kicked the behavior of your skin back maybe a decade or two, so your skin behaves in a more youthful way, and it's shedding more, so you can use those acids to help take off the superficial stratum corneum, just the excess skin, and you'll be fine. But if you are sensitive, or if your skin is acting its own age and you haven't done that anti-aging skin restoration protocol or anything to do with retinoic acid in terms of stabilizing the skin, you might be much more sensitive. And so I agree, some people, if they were to use exfoliation every single day, they would look much worse. And that's where I think professional guidance comes in. You have to understand the cycles that the skin goes through and the changes it needs to go through to be strong and healthy and resilient. If you don't have strong skin and you exfoliate it every day, you'll damage it for sure.
How do you feel about antioxidants such as vitamin C or other antioxidants? Important?
I'm a huge fan of antioxidants.
Okay. Tell us which ones.
So we can start with vitamin C. That's I think the gold standard that everyone loves. Vitamin C in the form of L-ascorbic acid, which is the active form again, it's an excellent product, but it's extremely unstable. It's not stable. It's sensitive to light, temperature, and air. And so any formulation of L-ascorbic acid that isn't in a dark bottle with an airtight closure, room temperatures up to the consumer, but is a vitamin C I wouldn't trust, because it's going to oxidize the very first time you open it. No matter how expensive it is, no matter how good it is, plan on using that bottle a month at most. And then you're just fooling yourself after that. But antioxidants in general, I think, are fantastic, especially in today's day and age when we have so much pollution, because all they do is basically neutralize free radicals. So if a free radical wants to steal an electron, rather than doing that from our skin, the antioxidant says, here I am, take it from me. And it protects our skin. So I'm a huge fan, definitely.
Okay. So ascorbic acid, very unstable. What is your favorite form of vitamin C then? Do you still use ascorbic acid? Do you use?
I don't actually. I don't use ascorbic acid. Just because, like I said, I have not found the right packaging for the right formulation. If someone came out with something like that, I think that would be a great business model. But I pay attention. There are so many antioxidants now. They're discovering more and more that are just as potent when in vitro, of course, not in vivo studies, or even more potent than vitamin C. And so I think if you get a nice combination, a nice medley of various types of antioxidants put together, it's good enough.
What about peptides? Do you think that they're worthwhile? And if so, what are your favorite peptides?
It depends. Yes, they are worthwhile. And no, most of the time they're not worthwhile. Peptides are excellent. They're a lot of the time they're just little messengers. If you can think of just little messengers, that's their purpose. They go into the skin and they send messages. Make more collagen, make more elastin, clean up this old collagen. So they're excellent. But the problem with peptides is they're very large molecules for the skin to absorb. And so I would say in 99% of products, when you buy a peptide, it just sits on your skin and it doesn't do anything. So it's a marketing scam. They know peptides are popular. They're written about in articles. So the company will make a peptide serum, but they don't care about the delivery system and the vehicle to get it deep into the skin, because that's where it has to go. It has to get into that dermis. So I think most peptide formulations are a waste of money. But if you find a company that has an elegant technology that has been shown to work, then they're absolutely worth your money. So, for example, elastin that's an interesting company. It was started by a surgeon who specialized for decades in wound care. So his interest was healing and repair of skin. And the way I became convinced with the peptides in elastin is that they took histology, they took biopsies from patients before and after using their peptides. And they did develop a specific vehicle that coats the peptides so they can penetrate deeper into the skin. And the histology slides showed a clear difference. So when you see histology, to me, that's the best proof, because you see it, it's right there. So I would, again, be very choosy. And peptides are expensive. So if you're on a budget and it's a real splurge for you, don't save and buy a less expensive peptide. Buy a better retinol and skip the peptide. If you can afford it, then yeah, it's a great addition to your skincare routine.
And along the line of peptides, what about growth factors?
In a sense, growth factors are peptides. They're just specific peptides. And I would say it's a little bit of the same thing. Some people have issues of where the growth factors come from. So the best ones would be human, but then there's question of contamination. There's a hypothetical risk of maybe encouraging the growth of malignant cells. So some people stay away from growth factors because they're concerned it could promote the growth of malignant cells. I think growth factors are great. I enjoy them, but I don't think that they're essential in skincare. I think they're a luxury. They're the cherry on top. But if someone was beginning to build a skincare routine, that would not be my number one go-to.
What would be your number one go-to?
Retinoic acid and sunscreen.
Okay. Simple. Okay.
Yeah. And I like to spread it out like that because some people either don't have time, or men don't like to spend a lot of time doing skincare. So I like to start really basic for someone who wants results, but they don't want a 10-step routine. And then some of us love that ritual and love the many steps in the bathroom. And then for those individuals, I want them to understand that, where there's a role for each type of product. And there's absolutely a role for growth factors. They add, but not enough. Not enough to justify the price, and not enough to substitute with everything else. So that's how I look at growth factors.
It makes sense. Now, you just mentioned some of us enjoy having this elaborate routine, but is there a point where too much is too much? I have a friend, for example, she uses 15 different products at night. And I think, how can the skin even absorb that much? And how do we know that they all get along? So
yes.
Do you think at some point too much is just not a good thing? Or
I think too much is not a good thing. I don't know exactly where that limit or cutoff would be. but 15 products does seem a little excessive. Yeah,
It is.
I agree with you. I think once you're layering number 15, I'm not sure how it's going to get through. And of course, all those products are interacting with one another on some level. So I'll give you a great example. So hypochlorous acid is becoming popular. I've seen on Instagram girls buying hypochlorous acid and spraying their face, and it's great for antibacterial, it's great for acne, and that's all true. I actually use hypochlorous acid in my office as well. However, it's important to know that hypochlorous acid kills bacteria. It almost acts like a free radical on the bacteria. So if you apply hypochlorous acid on your face and then you go and you apply your antioxidant serum, you're neutralizing your antioxidant serum because the hypochlorous acid is going to use a lot of those antioxidants. So certain things don't go together. You can either stick with one brand to avoid it and just follow their protocol. And I think when you begin mixing brands, you really have to understand what plays well together and what doesn't.
That makes sense. But in the case of hypochlorous acid, which is actually something I'm using right now on my little dog who is behind us because she had surgery, and I'm sterilizing her wound with it or cleaning her wound with it.
Yeah, it's fantastic.
It is fantastic, but wouldn't it almost be better than to use an antioxidant so you don't get a lot of free radical damage? You said they cancel each other out, which makes sense. But wouldn't it actually be better to use an antioxidant to not get the free radical damage if you decide to use that on your skin?
You could, yeah. But you have to remember that you're once you apply it, and let's say you're going out into the sun and into the streets with cars and pollution, it's not as strong. It's not in full effect. But you make a good point, actually. You want to kill those bacteria and protect the skin. I will add one thing. Because this is so commonplace these days, is people will look at ingredients and evaluate a product and critique a product based on the ingredients. And I think that's it's not a good way to do it, because unless you understand the formulation, the ingredients don't matter. And I think that's so important to understand. I've seen so many videos of people critiquing products that I understand the formulation of, and the things they're saying are just, they're not true, but there's no way for them to know because they're just looking at ingredients. And so I think it's really important to remember that. And my favorite analogy for that is if you look at ingredients for cooking in the kitchen. So if we take an egg, for example, and you're making a cake, you don't want scrambled eggs. If the cake calls for eggs, sometimes we separate, right? We'll separate the egg yolks and we'll beat them. We'll separate the egg whites and we'll beat them, like in tiramisu. And then we combine the egg and the yolk separately in different layers of the cake. So that's completely different from a scrambled egg. But if you read the ingredients, the products just have egg. And that's a great example of how skincare is misinterpreted by just looking at ingredients. Because the ingredient is one thing, but how is it packaged? What is it attached to? What drives it into the skin? It all makes a huge, huge difference.
Wouldn't you say the same is true with sunscreen? For example, we look at physical sunscreen and go, oh, this has 20% zinc oxide versus this one has only 10. So the 20% should be stronger. But you can't really look at it that way either, right?
Exactly. Because again, it's formulation. And there are so many ways that they make the sunscreens. Like I said, they make craters and they attach molecules to them, or they make bubbles and they put the zinc oxide inside, or they make bubbles of zinc oxide and put something else inside. There are so many different ways to formulate it. And unfortunately, because these companies all compete with one another, they all have patents, they all have proprietary technology. They don't want to share this information so someone else doesn't steal it. And so it's very, very hard for the consumer to get that information. It's almost impossible. Once you work with a company, they disclose a lot more to you. They still don't tell you everything. There's plenty they don't tell you, but they disclose a lot more of that. So it's possible to understand why a product is as good as it is. So I think that's really, really important. Don't just look at the ingredients to evaluate a product.
So what would you suggest a consumer does if looking at the ingredient is not enough, the ingredient list is not enough? How do we educate ourselves on certain products?
It's very difficult, very difficult. You can talk to specialists, people who really understand certain skincare lines. Sometimes that can be an esthetician. Estheticians will often, good medical estheticians who are more focused on results and targeted treatments rather than massage and relaxation. And there's nothing wrong with either one, but the ones that are more results driven tend to understand their formulations a little bit better, and they get that information. They choose products based on that. Also, and again, it's not all dermatologists. You have to have an interest in this particular field. But if you find someone who has that knowledge, who has the interest, listening to them. But I think looking at results, looking at publications, looking at whether these companies do legitimate research. There's a lot of companies that claim to be incredible, but they really don't do any research. The best research is going to be biopsy and histology slides. Others is maybe using products and looking at the visiocams and looking at the changes in the skin through the cameras. Look, this product was used, nothing else was used, and look at the change from here to here. So, but it's hard. You'd have to do really a lot of digging and a lot of research to come up with what's really good. I went through that when I was choosing what to work with. It was really hard to finally settle on brands. And I get solicited all the time. We're new, we're great, try us. Or, we'll pay you if you make a video about this. And if I don't believe in it, I won't do it. So it's I guess if you find your trusted sources, that you can hope they guide you in the right direction.
So on that note, would you say, I mean, when we're talking about them having slides and studies and stuff, we're talking about medical skincare. Would you say that medical skincare is superior to what's found at Sephora or other stores? Or
so that's also a multi-level question. The term medical skincare, medical grade professional skincare, that's a garbage, meaningless term. It's a marketing term. It doesn't mean anything. So a really shitty company, pardon my language, can claim that they're medical grade, and all that means is they've decided they're going to sell through medical spas and doctors' offices. So they're a very mediocre company, but they're selling here, so therefore they're medical grade. So the term means nothing. However, if you go into that term and you look for good companies, you will find excellent companies that I think are better than Sephora, 100% better than Sephora, better than your very expensive products at Neiman Marcus or Saks Fifth Avenue, and definitely better than drugstore. So the ingredients are better quality. The packaging, also, you have to remember, their money goes into multiple steps. One is the formulation. Another one is the packaging. Is it sealed? Is it vacuum sealed? Can air get in there? You can look for that. People can say it seems wasteful, but there's a purpose to it. It's to keep things fresh. So anytime you put your finger in a cream, you leave bacteria and your own dead skin cells in that cream. So that must mean it has to have more preservatives. But so I think once you're in the medical grade category, you're not free. You still have to dig and look for who's just using it as a marketing scheme and who's making really good skincare. But in that category, I think you will find exceptional skincare, and you won't find anything like that at the drugstore. The quality of their ingredients is better. Again, if we go back to the kitchen, there's high quality foods and then there's low quality foods, whether it's, farm grown or organic or whatever it is. There's different grades of quality when it comes to food and nutrition. And it's the same in skincare. And those ingredients are going to be more expensive. So the products are going to be more expensive. But that's why I always say, when we talked about the alpha hydroxy acids, there are certain molecules. It won't be the formulation, because no one's going to invest in that and sell an inexpensive product. But not everyone can afford medical grade skincare. So there are certain things, like, for example, alpha hydroxy acids, that are simple. You can even make it at home in your kitchen if you take tomatoes or papaya or pineapple, and those have alpha hydroxy acids in them. So that's why I say, if you're on a budget, don't waste your money on peptides. Don't waste your money on growth. They just won't get in your skin. And if you can't afford it, then that's fine. So you can save on some products and you have to spend more to get the results on other products. But the term medical grade itself is meaningless, unfortunately.
Yeah.
It's a non-regulated industry.
I could talk to you for hours, but I don't want to keep you forever, but I want to ask you one more question. Okay. I recently made a video on topical estrogen for skin aging. I don't know if you saw that or not.
I haven't yet.
There are some studies suggesting that that actually helps with collagen synthesis and less lines and wrinkles. Do you have any experience with that? What are your thoughts on topical estrogen once we are in menopause or our estrogen production goes down?
It makes perfect sense to me. So topical, you want topical estrogen because if you consume it, it's going to go through the liver first, and you don't want it to go through the liver first. So if it's on the skin, it behaves more as though your body produced it. So you want to mimic nature. But it's well proven that women who have less estrogen, who are heading into menopause, their collagen significantly drops. So estrogen, our bodies are wired, all of our organs are wired to have that estrogen in them. Once we hit puberty, we morph into estrogen needing beings. So when that estrogen begins to drop, that's why there's so much dysregulation. Hair falls out, collagen synthesis drops even further because it starts dropping in our 20s slowly. But then once we hit menopause, it picks up the speed again. So I think it's fantastic.
That's good to know. I use HRT. I've been on HRT since I was 38, but I just recently started using an estrogen face cream after looking at some other studies. I can't tell if it's making any difference or not, but the studies seem quite promising. So I'm going to continue to use it and see if it actually indeed makes a difference. And the studies actually said that even women who had been on HRT still saw more improvement as far as collagen synthesis with topical estrogen as well. So
that's something I have to look into, actually. I have had a few people ask me about it. I know there are a few brands that produce estrogen creams, but now you've piqued my interest. Maybe I'll look into it deeper, try to understand it more.
It makes sense since we have estrogen receptors all over our skin. So it does make sense.
Does make sense. Yeah.
Like I said, Dr. Ania, this was amazing. I feel like you're my best friend already. This was amazing. I could talk to you for hours, and I hope you will be back.
I would love to be back. Thank you so much for having me.
Thank you so much for being here.